Okay, so let's say that you're anemic and we need to up your iron because you need iron in order for the hemoglobin to bind to the red blood cells and transport your oxygen. So you're not moving oxygen well. So we want to give you some iron. So we are going to do ferrous sulfate, Fe iron, ferrous sulfate. Now, if you're given injections, you want to use the Z-Track method to keep from damaging or irritating the skin. And you want to make sure that you're giving vitamin C for this iron to be absorbed. You're going to want to watch for stomach upset because it may be causing some black stools, may cause some hypotension. So you're going to want to watch out for how you sit up. And this is for iron deficiency and the prevention of iron deficiency, like in pregnancy. You might take extra iron. So, the story for ferrous sulfate. Iron is essential to create hemoglobin, and it binds to the red blood cells for transporting oxygen. So, a patient who is anemic, red blood cell count is low, and isn't moving oxygen well. Therefore, an iron supplement is needed. Instruct the patient to eat lots of vitamin C-rich foods. Use the Z-Track method for injection because it can damage or irritate the skin. And watch for stomach upset. It may cause black stools or green stools. Next, we're going to look at diuretics. So what do diuretics do? They make you pee a lot. They get rid of water. So the first one we're going to look at is hydrochlorothiazide, HCTZ. It's a so see that thi in the name, thiazide. So think of that thiazide diuretic. It's similar to a loop diuretic, but not the same because it considerably lower than maximum diuresis produced. So it promotes urine production by blocking the reabsorption of sodium and chloride. It cannot be used to promote fluid loss in patients with severe renal impairment. You want to run a complete metabolic panel to make sure that their electrolytes are staying in balance, and you want to be looking at their blood pressure. This medicine won't cause you to lose your hearing. That's a very good thing. Electrolyte levels should be determined periodically, and the patient should be weighed on a regular basis. Potassium levels should be measured periodically. The diabetic patient may require larger doses of insulin or other hypoglycemic drugs while using this product. It has less of an effect than other the loop diuretics, but it still can cause hyponatremia, hypochloremia, and dehydration. Hypokalemia, the other one was chloremia. Now you get an excessive excretion of potassium. It can increase your levels of LDL cholesterol and triglycerides, and you want to watch for magnesium deficiency. You want to make sure you're eating foods rich in vitamin K to minimize the hypokalemia. You want to watch for muscle weakness, tremors, twitching, and dysrhythmias. That's all showing that your calcium levels are a little low. Okay, so the story on hydrochlorothiazide, HCTZ, a patient is suffering from hypertension and coronary heart failure. So they got a lot of liquid in there, and we need to try to get it out. You want to make sure that they're not suffering from a renal impairment before you give them this medicine. Ask about diabetes because they're going to need to increase their insulin, and you're going to want to monitor their complete metabolic panel, and you're checking for the electrolytes. You're also monitoring for dehydration and hypolacemia because remember, you're asking them to eat more foods rich in potassium. Now, it could be raising their LDL cholesterol and triglycerides. So if a patient takes it home, make sure you're teaching them to take their blood pressure because it could also increase their blood pressure. Okay, that's a pretty long one. The next one is spirolactin, and I think of how I remember that spirolactin is a diuretic is because the pee is spiraling out of your body. Now this one doesn't take as much potassium with it. So spire kind of sounds like spare. It's sparing the potassium. Now, one important thing to note, if you're a healthcare worker, you want to be double gloving and wearing that gown because otherwise, if this gets on your fingers, it can cause fetal harm if you are pregnant. Blood pressure and edema will decrease once the fluid is shifted out of the body. That's why you're taking it. You're going to watch their intake and output levels, watch the renal function and their potassium levels. Even though it spares potassium, you still want to, it still could be a side effect. So can produce fatal dysrhythmias. So it can make your heart beat in a way that it could kill you. So you want to be watching this. Steroid derivative in medicine can cause hypocalcemia, menstrual irregularities, impotence, and the deepening of your voice. So there's some steroids in here you want to be careful of. The medicine can take up to 48 hours to develop. So it's like 2 days. So tell your patients keep taking the medicine. It may not be working at first, but it's going to slowly kick in. It's commonly used in a combination with thrinazide with a loop diuretic. In patients with severe heart failure, it reduces the mortality and hospital admission rates. Okay, so here is a loop diuretic. So this one is furosemide. Furosemide is a loop diuretic. It blocks reabsorption. It's used for bulimia, edema unresponsive to other drugs, and hypertension not responsive to other meds. Now, why would you give the others first? Well, it can cause hypotension, thrombus, and an embolism. It rarely, but it can cause irreversible hearing loss, so that's why you're trying other medicines first. It is used to increase the urine output for patients who are retaining fluid. It can cause excessive loss of sodium, chloride, and water. So you're monitoring for dehydration. It is going to lower your blood pressure because you're getting all that water out. So you want to be checking, because if it lowers it too much, then you could have dizziness, lightheadedness. You may have an increased loss of potassium, so you're checking that potassium level. Remember, normal is 3.5 to 5. And is the patient taking digoxin? Because you can't have low potassium levels, and we know digoxin causes low levels. So you might want to, if they're taking digoxin, you might want to look at switching to a potassium sparing, like the spironolactone. Okay, so side effects are excessive loss of sodium, chloride, and water, and it can cause dehydration. So what you're going to tell your parents is the diuresis can begin in 60 minutes, and it's going to last for up to 8 hours. Probably not a great time to go on a car ride. The IV begins 5 minutes and can last for 2 hours. It's used in critical situations, for example, in pulmonary edema. Severe dehydration can result, so you're watching for dry mouth, unusual thirst, and olguria, which is scanty urine production. You can have a headache and chest pain. Calves, pelvis should be reported, because what could that be? Because remember, one of the things that can cause is thrombosis and an embolism. So if you're having pain and you're thinking it might be a blood clot, we need to get that checked out. So this medicine can make a patient lose water and electrolytes. The patient should be giving periodic complete metabolic profile screenings to monitor for electrolytes and watch for electrolyte imbalances. You're watching your blood pressure before giving it, because it's going to drop that blood pressure, especially if they're also taking hypertensive medicines too. You're watching for hypocalcemia. You don't want that potassium level to get too low. You're monitoring your EKG and urine output, and you're watching for dehydration, dizziness, lightheadedness. Remember, normal levels are 3.5 and 5. If it falls below that 3.5, you can get dysrhythmia, which, of course, we know is bad. And if taking digoxin, you want to switch to spironolactone. Okay, so now this is the end of pharmacology 4, and the next one will be 5.